Right, so we want to have a discussion on that very, very important issue on the polio vaccine. Well, this comes as, the World Organization is urging the Catholic Church in the country to drop its call on Kenyans to boycott the polio vaccination campaign, saying that, the vaccine is safe. The controversy on the polio immunization heightened ahead of its launch in the country on Saturday, with the Catholic Church questioning the safety of the vaccine. And we're now joined by Liz Wala, who is the CEO of the Kenya Medical Association. Liz, she's joining us from the City Center studio. Thank you very much for joining us, Liz. From where you sit, what do you make of this back and forth in between the Catholic Church, government, and now the WHO rather says, that this vaccine is actually safe? What do you make of this?
Thank you very much, and we are glad to be represented here as the Kenya Medical Association. Mm-hmm. I think top on our agenda is the health care of Kenyans, to leave alone the sideshows that are derailing a very important public health campaign. From our standing, we do insist that the campaign goes on, because properly laid procedures have already been followed in regards with quality assurance and testing of these vaccines. So in terms of the objections that are being set up by the Catholic bishops, we are of the opinion that this campaign is very paramount to our efforts as a country in eradicating polio.
Do you know how informed, the Catholic Church is in terms of saying, that the polio vaccine is actually not safe? Do you know of any, surveys or, tests that they have done to back their argument?
No, from the statements that I read, the one that was released 2 days ago, their concern seems to be that they have not been involved in joint testing of these vaccines. And from the standpoint of the way vaccines are procured and manufactured and distributed, there are very stringent rules that are applied, because most of them are biological agents. And so for us to, again, subject the same vaccines in a local setting really beats the purpose, because even the capacity of the local laboratories to perform the tests that are required for vaccines is, none of the laboratories can actually meet the standards to run the full battery of tests required.
From a layman's point of view, this vaccine has been in existence since so many years ago. Mm-hmm. I mean, I'm sure you had it, I had it, and so many other people, since so many years ago. Why is this contention building up now? Is it that it's a new kind of vaccine, polio vaccine, or what? Why now?
The polio vaccine has been in existence for several years, it is true. In fact, what is amazing is that the same vaccine that is proposed to be used in the campaign is what is already being administered in routine vaccination clinics in the government setup and in the private healthcare providers setup. So it is also our concern as medical professionals that this objection is arising. Number one. Number two also is that they have not indicated what exactly are the safety concerns they have, because it is more of a matter of speculation rather than they've identified an issue and they want that issue pursued.
Right, Liz, we want to understand, if a child does not have this particular immunization, what happens? Break it down for us so that we understand the importance of this vaccination from your standing.
Okay, so the polio virus is spread through the feces. Mm-hmm. So a child can get it from the environment. Mm-hmm. And when a child gets it, they'll experience initially symptoms similar to malaria, like fever and joint pains and malaise. But after that, within a few hours, the virus spreads to the nerves and causes paralysis. Often it causes paralysis of the limbs, but then it can also spread to the muscles of the chest, so affecting breathing and eventually killing. And it is very important to know that polio does not only affect children, it does affect adults. In fact, our most recent cases in 2013 had 3 adults affected and 2 of them died from polio. So it is important that when this vaccine is administered to children through the mouth, they actually shed bits of it in the environment, and hence any child who may have been missed in the campaign or in the routine immunization is also able to be protected from the environment, something that we call herd immunity. Yes.
All right, Liz, you know, we want to keep you here with us for a short time because we want to take a short commercial break. But one of the things that we'll be talking about once you come in, because there are parents who are watching and they're wondering, okay, fine, so the church says that I should not take my child for immunization, and you know, the government says we should. So what should they do? I mean, that bit of confusion there, we'll be talking about it in a short while. Stay with us. We are giving you the latest news updates here on KTN News Desk. My name is Betty Kialo. We will be back after this short break. Stay with us.